Let's dive right in. Prescribing controlled substances is without a doubt one of the highest risk things you do in modern medicine. So, in this explainer, we're going to break down the essential framework for doing it safely. This is all about protecting your patients, your license, and of course, your career. And make no mistake, the risks here are huge. A simple prescribing error or a moment of noncompliance isn't just a clinical problem, it can spiral into criminal charges, the loss of your license, and serious penalties. The stakes really couldn't be any higher. So, why do we call this area a legal minefield? Well, it's because these medications, while absolutely essential for so many patients, carry these huge risks of misuse, addiction, and, diversion into illegal channels. Every single prescription you write carries that weight. So, to get on the same page, what exactly is a controlled substance? Well, officially, it's any drug that a government has decided needs special rules. And the reason is always the same: its potential for abuse and the risk of addiction. That's why they're handled so differently. And that's what places this unique burden of responsibility right on your shoulders as the prescriber. We're not talking about obscure drugs here. We're talking about medications you see every day. Things like powerful opioids, morphine, fentanyl, benzodiazepines like alprazolam, ADHD stimulants, and even certain codeine-based cough syrups and sleep aids. They are critical tools in your toolkit, for sure, but every single one of them carries a significant legal weight. So to get through this minefield safely, you absolutely need a map. And that map is the legal framework that governs all of these substances. Understanding these rules isn't just a good idea, it's the very foundation of a safe, defensible practice. The interesting thing is, these legal principles are pretty consistent no matter where you are in the world. You have to justify the prescription, you have to document everything meticulously, you have to monitor the patient, and you have to try and prevent diversion. Here in India, these exact principles are written into law under the Narcotic Drugs and Psychotropic Substances Act. You know it as the NDPS Act, and they're backed up by the National Medical Commission regulations. Okay, so knowing the rules is one thing, but actually applying them day to day requires a proactive strategy. I want you to think of this as your offense, the concrete actions you take with every single patient to make sure you're prescribing safely and responsibly right from the get-go. This 6-step process is basically your clinical playbook. Okay, step 1, verify the patient and establish a clear, legitimate medical purpose. Step 2, always start with the lowest effective dose. 3, educate your patient. Talk about the risks, safe storage, overdose signs. 4, be incredibly careful with high-risk combos, especially sedatives and opioids. 5, make sure you have regular monitoring scheduled. And finally, number 6, the one that holds it all together, document every single decision and interaction. Now, every good offense needs a solid defense. And in this world, your defense is all about your ability to spot high-risk red flags. This is about being vigilant, about recognizing those subtle behaviors or patterns that might hint at misuse, addiction, or diversion. And this brings us to what is, honestly, the core clinical challenge, the one that can trip up even the most seasoned clinicians. How do you actually tell the difference between a patient who's in genuine need and one who is exhibiting drug-seeking behavior? Well, the answer really lies in knowing what signs to look for. Some of the key red flags include things like doctor shopping, going to multiple prescribers, or repeatedly claiming that prescriptions were lost or stolen. You should also be wary of patients requesting specific, high-value brands by name, or if their medical history just doesn't add up, or if they refuse diagnostic tests. Look, any one of these is a concern. A pattern of them means you need to be extremely cautious. And that brings us to the most critical element of your defense, and that is your documentation. I want you to stop thinking of this as administrative work. It's not. It's your legal fortress. If there's ever a dispute, your clinical notes are your first and, frankly, your most powerful line of defense. Think about it. When your decisions are being scrutinized, whether it's by a medical counsel or in a court of law, all the clinical complexities, all the nuances, they all just boil down to one simple, unyielding rule that trumps everything else. And here it is. From a legal standpoint, if you didn't write it down, it just didn't happen. Your clinical judgment, your risk assessment, your patient education, none of that exists without a clear, contemporaneous record. It's that simple. So let's compare what strong documentation looks like versus what it doesn't. Your notes must always justify the diagnosis, and they have to detail your risk-benefit analysis. You have to avoid notes like, patient demanded this medication. Notes like that are legally toxic because they basically suggest your medical judgment was compromised. You have to stay objective, professional, and thorough. Always. So, how do we pull all of this together into a strategy that you can actually use? Well, it really just comes down to a few core principles that should guide every single prescribing decision you make. So, here's your framework for safety. It all starts with a careful diagnosis. That diagnosis is then protected by a fortress of documentation. It requires vigilant monitoring, the ability to recognize and act on red flags, strict legal compliance, and an active effort to prevent diversion. This whole package, this is the path to safe and legally defensible prescribing. So we'll end with a final question for you to really think about. If you look at your current habits, your documentation style, your level of vigilance, is your prescribing practice legally defensible right now? The whole point of this explainer is to make sure your answer to that question is a confident, resounding yes.